A new report ranks Texas 49th in women's health and reproductive care. One group of doctors is looking to address this tendency and deficiency, one that is even more pronounced among black women. Fox 4's Shaun Rabb has more in this week's Here and Now report.
There's a new report by the Commonwealth Fund that ranked Texas as 49th in the nation when it comes to reproductive and women's health care. And so to talk about this and talk about what they are trying to do to change this dynamic, I want to talk today with some folks from the Texas Association of Black Female Physicians. Pamela Lowry is the chairman of that body. Dr. Lisa Taylor Kennedy is the president, and Dr. Juanita Crable, board certified obstetrician gynecologist, one of the founding members. First, I just want to jump in and get reaction to the fact that only New Mexico and Mississippi rank lower than Texas.
You know what, Shaun, and that's exactly why this organization was formed, because we saw that there is not only a need on the patient side, but also on the physician side.
Dr. Kennedy, tell us what you see as the aim of the Texas Association of Black Female Physicians.
Well, one of our aims is really just to improve the health status of Black women in Texas. And part of the issue is just education. Many of our patients don't have the information, and some never see a doctor. We say, well, I'm healthy, I don't have any health issues. Well, you don't have any if you don't go see a physician. So you may not know that you have underlying hypertension, which is one of the major causes of mortality, morbidity in pregnant patients, but also in people in general.
I think it's a broad spectrum of things, but what I see on the medical level and in my clinic, one thing that I see a lot in my office is mistrust. And I think when patients see someone who looks like them, it kind of decreases that barrier a little bit. And so, yes, I still have struggles, trying to educate my patients, but I think just history in the U.S. just leads a lot of these patients that look like us to have a lot of mistrust in the medical community. Getting the education out there and letting people know that we are on their side and we are here trying to help them, not harm them. I think, that's a message that I have to speak pretty much every day in my clinic. We have a lot of health issues that can lead to infertility. So one thing that I treat often is fibroids. And I just think sometimes those things are overlooked. And then I also see a lot of endometriosis, which we know is oftentimes misdiagnosed. And I don't think that we emphasize enough and get enough education out to women in this state, again, because of a broader spectrum of things about these topics. And I think that's very, very important.
We want to partner and plan on partnering with churches around Dallas, as well as some of our social organizations, sororities, fraternities, Jack and Jill of America, other Black organizations that can reach the population at large.
I want to make sure that we make it clear that we're for all patients and all physicians, but also too, on the flip side, we will provide cultural competency training so everyone will know how to also deal with not only the Black patient, but also the Black physician. And if people would like to have more information, they can always check us out at blackfemalephysician.com so we can provide resources to quality care.
And what's that website again?
It's blackfemalephysician.com.
Pamela Lowry, Dr. Lisa Kennedy, and Dr. Juanita Crable, thank y'all for visiting with us and sharing your concerns about women's health. Thank you for your time.
Thank you, Shaun.
Thank you.
And for more information on their work and educational opportunities being created, check out their website at blackfemalephysician.com.